it certainly makes us look and say, okay, we have to look at every aspect of every activity we do and make sure that we are funding the ones that are the most essential to our population. And that's how it should be to some degree, but it is going to force us to make some tough decisions.
Local health departments are facing potential budget cuts, but today those were challenged in court. And Kentucky Governor Andy Beshear signed on to the New York Attorney General lawsuit opposing the Trump administration's grant cuts. It's our top story here at 5:30. Thanks for sticking with us. Connie Leonard.
And I'm Doug Proffitt. Between Kentucky and Indiana, the DOGE agency says taxpayers saved $343 million in grant funding cuts to state health departments. Ian Hardwitt is joining us here with what's at stake. So, Ian, what's going on here is the COVID money is already dried up. It's no longer available, and now they are really dependent on the money that would come from the federal government.
Yeah, Doug, some of these health departments have actually already gone ahead and spent that money. It was allocated by Congress during the COVID-19 pandemic. Now, U.S. Health and Human Services officials argued that money flow should stop because the pandemic ended. However, the lawsuit challenging this move insists those grants were meant to fund public health infrastructure unrelated to the pandemic. In southern Indiana, the grant funds give Clark County's health department a little bit more flexibility.
In public health, we can do broad-based initiatives that help our whole community. That's probably my favorite part about it.
But Dr. Eric Yezel worries the Clark County Health Department won't have as much money for promoting events like this in the future. A lung cancer screening at Ivy Tech Community College in Sellersburg. The U.S. Health and Human Services Department Undersecretary RFK Jr. tried canceling billions of dollars in nationwide grant agreements with state public health departments. On Tuesday, layoffs of over 10,000 employees began.
I want to promise you now that we're going to do more with less. No American is going to be left behind.
The DOGE agency website reports over $387 million canceled in Indiana. It's money that trickles down to local health departments, money Yezel may lose.
Every dollar spent on public health is brought back, several times later down the road in savings for our citizens and our taxpayers.
In Kentucky, Governor Andy Beshear's office estimated the state may lose $148.8 million if the cuts go through. That money funds child vaccinations, addiction treatment, and the Purple Star program for veterans, plus more.
These are promises that the federal government made, and they're doing things like helping us have more people at our health clinics at a time when we're seeing measles outbreaks out there.
Beshear joined a New York Attorney General lawsuit that argues the move to pull funding violated Congress's constitutional power over federal spending. If pulled, Yezel said it would force him to make difficult decisions.
I'm disappointed. We've had more funding the last few years than we've had, in decades. And I think we've really been able to do some good things and some things that we're really proud of for our community. Just the other day, we were able to give an automated CPR device to a very rural fire department. And 24 hours later, they were able to utilize that on one of our citizens. And that's something we wouldn't have been able to do 10 years ago, and maybe something we won't be able to do 2 years from now if some of these funding changes happen.
Oh, what an example there.
Yeah, absolutely. And I guess, one of the things that they're worried about is these rural areas that don't have a whole lot of access to health care, like mobile clinics, things like that.
Yeah, Yezel said that, these basic functions of the public health department, doing some inspections on restaurants and things like that, that's all going to be fine. But it's those extra steps, getting out into the community and the partnerships, which are where those mobile clinics come into play, like you're talking about, Connie.
Okay.
All right. Thank you very much, Ian.